Good evening. Average waiting times in the Welsh NHS are longer than in England for most key treatments and diagnosis. Exclusive analysis by BBC Wales has found the biggest difference was for hip replacements. The average wait here was 197 days compared to 75 in England. The Welsh Government denies the NHS is failing but says more could be done to tackle delays. Our health correspondent Owain Clark has this special report.
If you're ill or in pain, you obviously want to be treated quickly, but Carol Whitfield from Mold had to wait more than a year for a hip replacement. According to NHS targets, nobody should wait that long.
It's a life-changing operation, totally life-changing. Unfortunately, the stress, the length of time that I had to wait has put pressure on my other hip. So I'm now, having recovered from the first operation, I'm now on the urgent list.
But is Carol's case exceptional or symptomatic of deeper problems in the Welsh NHS? Well, if you think answering that question would be easy, well, think again. That's because health statistics in Wales and England are often collected and measured in different ways. We've been digging deep and found figures we've been able to compare. They suggest the median waiting times in Wales was longer than in England by some margin for 7 out of 11 key treatments and diagnoses. For hip replacements, the average wait was 122 days longer here than on the other side of the border. And there was a difference of 70 days for diagnosing hernias. And for this, hips and treating cataracts, the gap with England had grown in the previous 3 years.
However we measure it, I think it's unacceptable for a patient with a painful hip to be waiting more than 6 months for a hip operation. The system is working flat out at the moment, and the staff in the hospitals are working flat out to try and keep up with the demand, but still the waiting lists appear to grow and do grow.
But there's more encouraging news on more urgent care. In 3 years, waiting times for types of heart surgery showed a big improvement, with the gap with England reducing by 65 days, although patients in Wales were still typically waiting almost 8 weeks longer. And the performance between the two nations is similar on cancer diagnosis and better on waiting times for kidney transplants. So why have waiting times lengthened for less urgent treatment? Well, according to the doctor in charge of a Wales-wide plan to reduce waiting times, it's a case, put simply, of supply not meeting demand.
If you're a service which receives 100 referrals per month, if you don't have the activity to cope with those 100 referrals per month, each month you're going to add patients to a waiting list. So the waiting list will grow and grow and grow and grow. And just to increase your activity to burn off the backlog, as it's commonly described, alone, can be toxic.
Right, so where's your niece on?
But here in Swansea, the local health board believes they've found one solution. 11,000 patients a year are seen by doctors and physiotherapists at this clinic. Gail Crockett came here within weeks. She may have been waiting many months had she been sent to see a hospital specialist. 80% of those that get seen here end up needing no extra treatment.
It's much more personal and much more easier, to come to this level rather than go into, more serious, like operations and things like that.
Majority of people do not need a surgical intervention. And I think the population is actually starting to get used to that idea as well. And I think looking after yourself and maintaining yourself with a good lifestyle is important.
So what accounts for the differences between Wales and England? Well, the waiting list gap has been there for a long time, so it's not a new problem. Also, the population of Wales, generally speaking, is older, sicker and poorer than in England, placing more burden on services. But independent experts tell us that wouldn't account for such a disparity.
Wales certainly does seem to have some difficulties with waiting times, but I think it is also worth pointing out that Wales has done some really good things in the area, for example, of patient safety and quality of care.
If you ask the public what matters to you more, the quality and the safety of treatment you get or the time that you get it, I think most people would say the quality and the safety is much more important. As long as people don't suffer harm while they're waiting.
So the message from him is don't judge the Welsh NHS on speed alone. But as we race towards the Welsh election, how quickly patients get treated will soon be at the heart of the debate.